Let's just jump right into this explainer by validating a very real, very heavy clinical reality that so many of you face every single day. Physician burnout is absolutely not a sign of a broken mind, it's not a lack of willpower, and it's for sure not a psychological failing. What it actually is an autonomic nervous system stuck in high gear. When we talk about transforming stress and preventing burnout in medicine, we really have to strip away the stigma and look straight at the objective science of what's happening inside the body.
So here's the million-dollar question the research is asking today. Can medical professionals actually biologically rewire their bodies to combat systemic depletion and build true clinical resilience? We're not talking about taking a vacation or, just trying to think positive. We're asking if we can actively intervene in our own neurobiology to prevent the kind of severe caregiver fatigue that drives so many brilliant minds out of medicine.
To figure that out, we're going to follow a pretty straightforward roadmap today. We'll start with the literal physiology of burnout, move into the heart-brain connection, decode HRV, unpack this science of coherence, and then wrap up with some highly practical on-the-go interventions. We're looking at hard evidence here, mapping the exact pathway from absolute physiological depletion to real renewal. All right, part one, let's look at the physiology of burnout and really strip away this notion that stress relief is just some kind of soft science. First things first, we have to stop looking at exhausted doctors as if they're broken. The emotions we usually label as negative, things like frustration, anxiety, impatience, they actually drive physiological changes that directly correlate with the stress response. Even super short bursts of these emotions can disrupt vital bodily processes. Sustained stress taxes your organs, completely depletes your energy reserves, and most crucially for a practicing clinician, it actively inhibits the higher cognitive centers in your brain. The biological reality of this is pretty stark. Stress literally takes the prefrontal cortex offline, which obviously limits sharp clinical decision-making. We can see this objectively. For instance, an unrecognized PSVT, a sudden atrial arrhythmia, can completely mimic panic disorder. If you treat the arrhythmia, the panic just disappears. This proves that erratic cardiovascular input actively creates negative emotional experiences. It's starting in the body, not just your head. Which brings us to part two, and honestly, a massive paradigm shift, the anatomical reality of the heart-brain connection. Think back to med school. We were all taught the brain is the top-down commander, right? But anatomically speaking, the heart actually sends way more afferent, or ascending, neural signals up through the vagus nerve to the medulla, the thalamus, and the amygdala than the cranial brain sends down. The heart is continuously firing vital neural traffic up into the brain, which profoundly influences how we process emotions and how we function cognitively. And if we zoom in on the microanatomy, we find the intrinsic cardiac ganglion. This is an incredibly sophisticated neural network sitting right inside the heart, packing roughly 40,000 neurons. It's essentially a little brain that can independently sense, learn, and make functional decisions about cardiac activity, completely independent of the cranial brain. So the heart is essentially this massive information processing hub. It communicates with the cranial brain and the entire body through four distinct biological pathways. First, there's the neurological pathway we just talked about via the nervous system. Second, the biophysical pathway, which is the literal pressure wave of your pulse. Third is biochemical through hormones, and remarkably, the heart produces just as much of the bonding hormone oxytocin as the brain does. And finally, there's an energetic pathway through electromagnetic interactions. Moving right along into part three, let's look at how all this data feeds into our primary objective biometric, heart rate variability, or HRV. Now, I know, normally if you hear chaos on a heart monitor, you're grabbing the crash cart. But here, it's exactly what we want. A healthy resting heart is absolutely not a metronome. Its beat-to-beat rhythm actually exhibits mathematical chaos. This moment-to-moment variability provides the exact flexibility your cardiovascular system needs to rapidly cope with sudden physical or psychological challenges in the environment. And HRV isn't just guesswork. It's a rigorously quantified metric. We use time and frequency domains, metrics like SDNN, RMSSD, and the LF/HF ratio, to precisely calculate your sympathovagal balance. Basically, it lets us quantify exactly how well the sympathetic and parasympathetic branches of your autonomic nervous system are playing together. The clinical implications here are pretty undeniable. An optimal level of resting, vaguely mediated high HRV is directly linked to increased resilience and your prefrontal cortex's ability to execute higher-level functions, like making sharp clinical decisions and regulating your emotions.
On the flip side, low HRV tells us there's autonomic exhaustion, severe systemic depletion, and cognitive inhibition. If your HRV is depressed, your body is literally biologically struggling to adapt to the stress of your shift.
So the obvious question is, how do we actively manipulate our HRV to pull ourselves out of that exhausted state? That brings us to part 4, the science of psychophysiological coherence. Emotions instantly alter your physiology. Negative, depleting emotions like frustration or anxiety create a very jagged, erratic, incoherent HRV pattern. It totally desynchronizes your nervous system. But when you self-generate a positive emotion, like genuine appreciation, the rhythm shifts into a smooth, highly ordered sine wave pattern. Suddenly, your heart, your brain, and your nervous system all fall perfectly into sync. That smooth pattern is what we call physiological coherence. And let's be super clear here. Coherence is absolutely not the same thing as mere relaxation. Sure, relaxation lowers your heart rate, but coherence is an active, highly measurable state of mind and body balance. It increases the stability of your vagal afferent nerve traffic, harmonizes your whole cardiorespiratory system, and actively facilitates brain function rather than inhibiting it.
Okay, part 5. Let's talk about actual on-the-go clinical interventions, because the reality of a chaotic ICU shift doesn't leave anyone time for a 1-hour meditation session. Enter the quick coherence technique. This is a hyper-efficient tool designed specifically for building self-regulatory capacity in the exact moment you need it. We're talking 1 to 2 minutes between patient rooms, while scrubbing in, or just sitting at the charting station. Here's the real-time 3-step re-engineering process. Step 1. Heart-focused breathing. You breathe at a 10-second rhythm, which physically modulates your vagal activity. Step 2. Activate a regenerative feeling, something like real appreciation. You have to actually feel it to change the biochemical pathways. Step 3. Radiate that feeling outward to actively shift yourself out of the stress response. And look, we don't have to guess if this actually holds up in the field. Consistently using these micro-interventions completely transforms clinical practice. By intervening right at the exact moment of stress, you build long-term self-regulatory capacity. You increase your behavioral flexibility, which means you're far less likely to snap at colleagues or lose focus when a case goes sideways. It even improves your patient connections because you're communicating from a coherent, balanced state. Ultimately, it gives you the power to shift from a baseline of absolute depletion to one of sustainable physiological renewal. I'll leave you with this to chew on before you start your next shift. Knowing the anatomy, the HRV data, and the science of coherence, will you continue to view your heart as just a mechanical pump, or will you actually use it as your most powerful, biologically proven tool for clinical resilience? If re-engineering your own physiology is entirely possible, isn't it time to unlock the intelligence of your heart?